Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. A big thank you to all those who have subscribed to this channel. If you're new to this channel and you want to learn more about your health, then please hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. In my last video, I spent some time with you talking about tension headache. You can check out the link in the description box below. Today, I'm going to be spending some time with you talking about another kind of headache, and this is called migraine. Migraine is a painful throbbing headache that typically occurs on one side of the head. Sometimes it occurs on both sides of the head. It affects about 15% of the worldwide population, and it occurs 3 times more in women than in men. It can even affect the day-to-day activity of the sufferer, and sometimes even walking can become a problem. Migraine is characterized by symptoms such as nausea, vomiting, and some stomach problems such as diarrhea. There can also be what we call photophobia, which is sensitivity to light, or phonophobia, which is sensitivity to noise. There is also a sensitivity to smell. Migraine is divided into various types, but today I'm going to concentrate on the 2 major types of migraine. We've got migraine with aura and migraine without aura. The aura is a visual disturbance that is characterized by you seeing sparkles and stars, zigzag lines, flashing lights, having a temporary blind spot. Sometimes it's associated also with numbness of the face and the arms. So migraine with aura is the type that you get the headache, the symptoms of migraine, plus the symptoms of the aura as well. The aura normally lasts for about 15 to 30 minutes. Sometimes the aura can occur before the headache kicks in, or it can occur when the headache starts as well. Migraine with aura occurs in about 10 to 30% of people who suffer from migraine. Migraine without aura occurs in about 70 to 90% of the people who suffer from migraine. It can last from 4 hours to 72 hours, and it is associated with the symptoms of migraine with no visual disturbance. Sometimes the visual disturbance can occur with no headache at all, and this is called migraine aura without headache. Apart from these groups, migraine can also be divided into episodic and chronic migraine. The episodic migraine is the type where you have episodes of migraine occurring on less than 15 days in 1 month. And the chronic migraine is the type that you have episodes of migraine occurring on more than 15 days in 1 month for at least 3 months. The exact cause of migraine is not known, but it has been linked to mood changes, some chemicals, nerves, and blood vessels in the brain. Also, genetics has been found to play a part because migraine can run in some families. Even though the exact cause of migraine is not known, some things have been established as triggers of migraine, and these include bright light, loud noise, altered sleep patterns. Certain foods like chocolate, cheese, salami have been found to trigger a migraine. Stress, anxiety, and depression are also triggers. Long distance travel, extreme weather, such as extreme heat, extreme cold, and extreme wind are also triggers. Missing your meals, menstruation is also a trigger. And this is because during menstruation, there is a change in the balance of hormones in the woman, and this can serve as a trigger. Head and neck injury is also a trigger. There are various things that you can do to prevent a migraine, and these include adopting a lifestyle change so as to avoid the triggers. You can eat regular meals with snacks in between and sleep at least 8 hours a night. Drink about 8 glasses of water a day to keep yourself hydrated. Get a food diary and look out for foods that trigger the migraine. Exercise regularly, but avoid strenuous exercise as this can trigger a migraine. Avoid bright and flickering lights. And do not sit behind the computer for long. Take at least a 10 minutes break every 1 hour. And to help keep your stress levels under control, make sure you don't get yourself overwhelmed with so many things. If you suffer from anxiety and depression and you realize it's getting worse, then speak to your doctor about it. There are so many things that can be done for you. And sometimes it might not be a medicine that the doctor would prescribe for you. There are non-medicinal ways of managing anxiety and depression. There is no cure for migraine, but the symptoms can be treated. Sometimes all you would need to do is stay in a dark room to avoid bright light and noise. Also, you need to keep yourself hydrated and avoid all the things that can make the headache worse. You can also visit the pharmacy and have a word with the pharmacist. There are painkillers that you can buy from the pharmacy. Ibuprofen and paracetamol are very effective in the treatment of migraine. But before you take them, make sure you read the patient information leaflets so you will be well informed about the drug that you are taking. Ibuprofen has to be taken with caution, and it is very essential that you have a word with the pharmacist. Sometimes you would need an anti-sickness tablet if you suffer vomiting and nausea with the migraine. These normally come in combination with the painkillers. Don't become too reliant on these painkillers, because if you do, then with time, they would no more be effective. There is also another group of drugs called triptans. These are also very effective in the management of migraine. These can be prescribed by both the pharmacist and the doctor. But before you get them, you need to go through a proper consultation so they would know whether it's appropriate for you to take it. I hope you have learned something new today. If you have, then please give this video a thumbs up. Also, don't forget to hit on that subscribe button and also on the notification bell so you don't miss any video that I upload. Please remember to share with family and friends and leave your comments, your suggestions, and your questions in the comment section. It's been a pleasure having a chat with you. Thanks so much for joining me today, and I hope to see you soon in my next video. Bye for now.